Hey guys, how's it going? I'm here today. I'm going to talk about Hashimoto's. This is the #1 cause of low thyroid in America. There's research studies out there saying that close to 70 to 80% of people with low thyroid actually suffer from Hashimoto's. So if you have low thyroid, it would be important to see if you have Hashimoto's. The reason why I'm going to talk about this today is because I have so many patients that literally have no idea what's even causing their disease. Even patients with Hashimoto's, they go from doctor to doctor to doctor trying different hormone replacements and not getting any help, and that's because their disease is totally neglected and they don't even really know about their disease. I'll ask them, okay, so you have Hashimoto's, do you know what that is? And oftentimes they'll say, no, what is it? So, this is important. So the reason I'm going to tell you in great detail what Hashimoto's is. So, one, how do we check for Hashimoto's? If someone is a low thyroid patient, what are the tests that we want to run? We can run a TPO antibody and an anti-thyroid globulin antibody, okay? Now, if this comes back high, above normal levels, then that patient has some type of autoimmune response, okay? When I say that, if they don't have a low thyroid at this time, basically if they have a TPO antibody that's high, what's happening is that the TPO antibody or the anti-thyroid globulin antibody will attack the follicular cells, and when that destroys tissue enough, then it will cause a low thyroid. So if somebody has a high TPO antibody but that doesn't actually even have a low thyroid, then it will be called Hashimoto's autoimmune reaction, okay? If somebody has a TPO antibody high or an anti-thyroid globulin antibody that's high, and they have actually hyperthyroid, it would be called Hashimoto's thyroiditis, okay? So that's called Hashimoto thyroiditis. If somebody has a TPO antibody that's high or an anti-thyroid globulin antibody that's high, and then they have a low thyroid, then that's when we call it Hashimoto's low thyroid. Okay, so either way, that's what they're called. If we see that you have an anti-thyroid globulin that's high or a TPO antibody that's high, what's happening is that antibody is slowly but surely attacking the follicular cells of the thyroid, and unless you actually get proper help, that's going to continue to get worse and worse and worse. A hormone replacement doesn't do anything for the autoimmune disease, and so these women with Hashimoto's that are on a thyroid hormone replacement, they'll continue to get worse and worse and worse until you see someone that knows how to properly manage your Hashimoto's. So the way that we manage this is that we figure out in great detail. We do all the extensive testing and analysis to figure out what's actually causing this immune response to increase. And every patient can be different from one patient to another. So some Hashimoto's patients have lots of different things, and the other Hashimoto's patients have totally different things that's triggering their response to attack the follicular cells of the thyroid. So what we do in great detail is go in, figure out what's causing their disease, what's triggering this immune response, and we figure out how we can dampen this immune response. And when we do that, the patients start getting tremendous results. They start feeling, getting their energy back. They start able to lose weight. They finally are happy. They get their quality of life back. These people with Hashimoto's are literally, this disease can take over their lives to where it can basically destroy everything that they've, that they have, and it can really cause so much fatigue to where they can hardly even do anything at all, and it can actually lead to other autoimmune diseases like lupus or RA or type 1 diabetes. All the research now that we're finding out is showing that people that actually do have Hashimoto's, 50% of them have some other antibody attacking some other tissue in the body. And so this is important because if we let this disease just rage and get worse and worse and worse, most likely this patient's going to have some other autoimmune disease besides Hashimoto's, and so that's not a pretty sight. We have patients come in here with all sorts of different autoimmune diseases because their autoimmune disease, Hashimoto's, was totally neglected from the get-go. And so if you guys have any questions, any concerns, feel free to email me. Feel free to call us too. We have free consultations for you guys. So come in and get help, and we'd love to take care of you. So thank you.